Hello, I'm Katrina Coleman with the Maryland Healthcare Education Institute. MHEI, along with the Healthcare Experience Foundation, are honored to provide you just-in-time tools to support and strengthen your leadership skills as you face this unprecedented pandemic. In today's brief video, we want to talk about resiliency and how you build your resiliency along with the resiliency of your staff. We'll briefly look at some of the stress that you are under, and we will provide you with tools to boost your resiliency. The things that we're hearing about as we talk to our frontline providers are the weeks of intense demands, the hours of intense demands. We also hear from frontline workers about the weeks that they aren't as busy and their census is low because elective surgeries have been canceled. We're managing visitors in a way we've never managed them before because they're not allowed in our buildings and organizations. That means that we're contacting those family members in a completely different way via our iPads, Zoom, Facebook messaging, FaceTime. And we're screening everyone who enters our premises. We personally have a fear on the front line of catching, passing, and bringing home COVID-19 to our loved ones. And there's a shortage of PPE, staff, and so much more in order for us to do our job. So the question is, how can we lift ourselves and others up? Resiliency is about rising above and bouncing back, adapting to change, and it provides a psychological body armor. Resiliency tools include positive emotions, 3 good things, and random acts of kindness. Let's look at each of these. The positive emotions based on the research of Dr. Barbara Fredrickson include pride and joy, awe and love, inspiration, amusement, hope, serenity, gratitude, and interest. When you as a leader can individually tap into any one of these emotions, you strengthen your resiliency. When your team and staff can tap into them 2 or 3 at a time, it's like resiliency on steroids. So take the moments in the day to find those things that inspire you, the things that you're grateful for, the things you find hope in, those moments of pride and joy. When we get that extubated patient, when we connect with families, when we come together as a team, tap into these emotions in the moments throughout your day, individually as well as a team. It strengthens your resiliency. The second tool is called 3 Good Things. It's based on the work of Dr. Brian Sexton from Duke University. The importance is identifying 3 good things at the end of your workday in your last 2 wakeful hours. Neuroscience has shown us that what we think about before we fall asleep physiologically changes our brain. So we want to be identifying 3 good things in our last 2 wakeful hours. They're good because they're good to you. They don't have to be phenomenal things of my child took her first steps. It could be something like, I had time to take a break today. It can be my spouse, my partner, my significant other got to the grocery store and I didn't have to do that. The point is, they're good because they're good to you. Once you identify those 3 good things in the last 2 wakeful hours, write them down. It's not a sentence, it's not a paragraph. Just write down, bullet point some words, those good things. Extubated patient, spouse went to grocery store, got laundry done. Write them down. And the third step is reflect on the why they are good. There's a difference in the connotation of why. One's positive and one's negative. For example, if one of the good things is the executive team rounded in my department today, you can tell yourself they rounded because they have to and they needed to check it off their to-do list. Or they rounded and they really listened to us. They're concerned for us. They want to know what's working and what's not working and what we need. There's a difference in the why. So identify 3 good things, write them down, reflect on the why. Doing that for 2 weeks will help to build your resiliency. The last tool we want to remind you of is random acts of kindness. You are probably seeing that in the community all around you, from the spirit and the support of community and the spirit and support of your staff. Make sure that you are acting kindly towards each other. It may be the fact that I have 10 minutes, what can I do for you today? I can cover a patient, I can give a med, I can help you with this. Random acts of kindness. Notice them in the community and notice them with each other. Take care of yourself. Resilience is very different than being numb. Resilience means you experience and you feel, you fail, you hurt, you fall, but you keep going. Thank you for all that you are doing on the front lines. And again, it's an honor for MHEI and the Healthcare Experience Foundation to support you.